Senator Kaine.
Mr. Chair, on this topic, I do think there are a number of areas where we have been and can be bipartisan. There's some huge differences of opinion. With the chairman, he and I have bills together to focus on auto enrollment in private pension plans for folks who work with companies that offer them. We have a bill to change the mandatory age for if a company offers a private pension plan. Right now, it has to make that available to every full-time worker over age 21, where we want to change it to over age 18. We have Social Security proposals. So there is some bipartisan space, albeit some differences of opinion. Here today, it strikes me that on some big principles, we ought to be able to agree. Devil's in the details. One is a principle that I don't hear disagreement about among the panel, that folks who want to unionize and vote for a union should be able to have a union. And one of the reasons I decided to support the PRO Act is the fact that after a tough unionization campaign, so often workers who successfully vote to unionize, they never see a contract. The employer, having lost the election, just never enters into a contract. And that seems to completely cut against the notion of a workplace democracy where there's an election and then there's a consequence. But if workers vote to unionize, they ought to see a contract, and the PRO Act provides a mechanism for that to happen. Second, workers should not be misclassified as independent contractors if they're employees, and that happens every day in every state, including Virginia. I've seen examples of it. But I'm also sympathetic to the position that folks who really want to be their own boss and be independent contractors should be. And so that balance, not letting people get ripped off and pushed into independent contractor status, allowing people who want to be their own boss to be their own boss, trying to find that balance is really important. Two of my three kids are artists, and they're just the classic. I mean, they wouldn't call themselves independent contractors. They would call themselves artists. And the way they make their way in the world is, part-time jobs that don't have any benefits, and then sale of art, often through like an LLC or something they set up to do their artistic work, and then other little gig work here and there. And that's what they want to do. They're not doing that because anybody's, an employer is pushing them to do it. They're doing it because that's what they want to do. And I kind of really admire it. It's kind of a DIY. I want to be my own boss. And wanting to be your own boss, was a good thing. And so trying to find that balance between keeping people from being ripped off and preserving the ability of folks who want to be their own boss to be their own boss. I mean, I think that's what we have to do. The two most important benefits, if you just summarize it, that need to be portable are health and retirement. And I acknowledge what Senator Hassan said. We've just taken a huge step backwards on the health side with the reconciliation bill. The CBO estimate is about 16 million people will lose their health insurance either because of changes to Medicaid or because of the changes to the premium support available under the Affordable Care Act. The ACA creation of exchanges where people could buy insurance individually and get premium support if they were low income has been a huge boon, in Virginia at least, to innovation and entrepreneurship. People who were locked into a job, I really wish I didn't have to work at this job and I'm locked into it because I need health insurance, suddenly had the ability to go and buy health insurance. And if they were starting out a business and they didn't have a lot of income, they could get premium support. And premium support that would enable them to have insurance for their family. That's how my two artist kids get health insurance. They don't have an employer that gives it to them. They get health insurance because they go on the exchange, and with premium support, they're able to afford it. Insurance at the end of the year, because of the expiration of some of the premium support that was put in place in the American Rescue Plan, is going to get dramatically more expensive, and especially for young people. For young working people, they're really going to see their premiums go up. And that's going to lock some people into jobs as employees when they would really want to be their own boss. So I applaud anybody who's going to bat for the artists and for the independent contractors, and I would just hope that you would be every bit as strong in supporting the availability of health insurance and premium support as we need to be, because we're going to see a tsunami of people losing health insurance or seeing their premiums jack up by 50, 70, 80% when we get to year end. And that is cutting against a goal that we all share, that people should have portable benefits. So that is my plea to everybody. And Mr. Chair, the last thing I'll say is this. I really wish this hearing was one where we were all sitting around a table and just like firing questions at each other, because this has been a good one, and a lot of ideas are out, and, you know, I'd like to interrupt somebody and challenge them, and I'd like them to interrupt me and challenge. So this is there is enough common ground conceptually with challenges on how do we find match on the details, that sort of the traditional 5 minutes and, okay, now on to the next witness doesn't necessarily get out what we need to get out. But I do think a panel like this and a discussion like this is really important. Sometimes on the health committee, it's like health, education, labor, pension. You know, we don't really give the P in the health committee the attention it deserves, and that's why even after being on the floor till 2:30 last night, I was really glad that you had this hearing this morning. Thanks.
Well, thank you for that. And my sense from that, there's an incredible amount of common ground to help our fellow American. So how do we get there?